Hi, OATN members. I'm here to provide you with an overview about this World Sight Day initiative of 100,000 screening to be done in 100 days. Because we kept receiving lots of questions. What is this whole initiative all about? Why should I participate? And what is this, what I'm expected to, and things like that. Even then, the response has been massive, enormous. So thanks to those who have already pitched in. But for those of you who have these doubts in your mind, this is going to provide you with that clarity. Okay. So, what is this all about, first of all? So, the International Agency for Prevention of Blindness recently launched this campaign called Love Your Eyes on account of the World Sight Day 2021. We know that 14th October 2021 is going to be observed as the World Sight Day. So, the entire month of October, we can do activities pertaining to the theme for World Sight Day. And this year's theme is Love Your Eyes. And love your eyes means you can love your own eyes, you can help everybody love their eyes. And as optometrist, there's nothing like, much more passionate for us than doing this. This is a poster that, we customized. We just wrote saying, love your eyes, love STEAM, OATN, and optometry. You can download this for your practice, like how I put the OATN logo here. You put your practice logo and you can create your own hashtags and use these posters in your practice and social media page. Now, beyond all that, the reason why this whole campaign is really becoming so very important is the recent United Nations resolution that was passed on the 23rd July 2021 that stated that vision for everyone. So you have committed to vision for everyone by 2030. And it says foresight is a wonderful thing. Now that the United Nations has committed to this challenge, especially because the United Nations saw, when it saw the Sustainable Development Goals, there are many Sustainable Development Goals, right? So when we look at the Sustainable Development Goals, be it working on eliminating or reducing poverty, reducing inequity, and everything, vision has a direct relationship. By working on vision impairment, each of these sustainable development goals can be achieved, and that's what the UN's resolution states, that vision for everyone is accelerating action on the sustainable development goals, and this is being adopted by the UN General Assembly. Now that the UN General Assembly has adopted this, so every country is trying to do their best to looking at ways to reduce visual impairment. And this is the best time that as optometrists, we should pitch in and we should contribute to our country's cause and to a global cause. I need not tell you this. The recent WHO's World Report on Vision and the blindness and the Lancet's the global burden of disease study and every other recent studies that spoke about the prevalence of blindness, distance vision impairment, and near vision impairment. What does it say? At least 2.2 billion people have a vision impairment or blindness, and that's nearly 1/3 of the world population. Most just need glasses. And some need low-cost surgery, which is screening for cataract and referral for cataract. Now, when we really look at the categories of vision impairment, as you see on the right side, looking at the mild vision impairment category, as you see the numbers in millions, these are all because of uncorrected refractive errors where you can contribute and bring the graph down. Look at uncorrected presbyopia, the numbers in millions, right? And when we look at the statistics in India, refractive error contributes to over 50% of the causes for preventable visual impairment, and presbyopia accounts to over 30%. Look at this map. Again, don't get perplexed. This is where we are, the South Asia. As you see here, when we look at the ophthalmologist to optometrist per million population, and also the aid standardized prevalence of vision impairment. So if you stay higher on this axis, the y-axis, which means you have large amounts of visual impairment. Yes, South Asia, India has large amounts of vision impairment. And we also have the lowest amount of optometrist to ophthalmologist ratio. Is this not the time to expand our services, to upskill our services to beyond refractive? Of course, refractive services are the key, but even beyond refractive services, should we do something about bringing down this vision impairment, given that there is reduced manpower and things like that? Of course, government is working towards all this, but this is the time we need to show up for this cause. Second, This really touched my heart. I'm sure that it's going to touch yours as well. We always see vision impairment as something that's really as a sensitive issue. We know, like, if somebody is suffering from vision loss, vision impairment, what it can do to their lives, all of us know. And we know that 253 million people are visually impaired and whatever. But the consequences of visual impairment is really important. They are three times more likely to be unemployed. They are three times more likely to be involved in accidents. They are three times more likely to suffer from depression and anxiety. They are two times more likely to have falls when they walk. Now, beyond all this, vision impairment is linked to increased risk of mortality, which means they die much, much earlier. And if providing them with simple spectacles and providing them with a refractive correction, if it's going to reduce their accidents and falls and depression and is going to provide them with employment and functional independence, then what you are doing is not just a service. By the spectacles that you're providing is not just a service. It's like a, I don't know what to call this, but you're doing really a greater service to mankind to a larger extent. So I think we need to really get to the heart of the problem and see how can I really serve at my best and how can I expand my services. This brings us to the crux of this problem, which is what can be done. Earlier, we would say that, people would come to us and people would come to our centers, be it the hospital or be it the service providers. But now we have to put people and communities at the front, and we have to look at how do we reach out to them and how do we make vision care services accessible at the level of people and communities. And of course, this is possible by integrating all the services, by integrating our early detection service, our rehabilitation service, our primary care services. But even beyond all that, I mean, this is the time when it is important for us to really look at this picture, like who are the healthcare providers. So take a look at this picture closely. Again, you can access the Lancet's Global Health Commission to take a closer look at this picture and how can you provide or integrate health systems. If you really look at it, the private sector where optometry refraction services definitely is a point where vision care services can be provided. Then children's eye health, children's health services, by doing screening, detection, and management of simple conditions, you can definitely integrate that to whatever you are currently doing. You can do health promotion, vision screening, refractive error screening that we were doing at the level of schools. Of course, we are yet to get back to the community level, but you could think about integrating that with your private sector place based practices, and at the level of workplace doing health promotion and vision screening and counseling employees and things like that. You can definitely do it. So really there is a lot of scope for us to integrate whatever that we are currently doing as private practitioners with our optical services and optometry services. We can definitely look at integrating our service such that we are able to bring down the number one or the one in the top five grand challenge. The five grand challenges again identified by the Lancet's Global Health Commission. Demand and access to refraction and spectacles, number one. Improving cataract services, improving children's eye health, services for marginalized groups, especially practitioners who are working in the rural community. Take this as Team OATN's honest request. Please organize something on behalf of the World Sight Day, because your support is going to actually extend in the sense, like, make a massive change to reducing vision impairments, and of course reducing out of pocket costs. I'm not getting into health economics, I'm not an expert, but look at the left side, the three stuff, and of course the one on the right. Can we not do? That is what this whole WSD, the World Sight Day work, is all about: providing vision screening such that we are able to pick up preventable visual causes for preventable visual impairment, and also providing picking up amblyogenic risk factors and enhancing child eye health services. Now, how do I do it? Coming to the aspect of implementation, how do I do it? This is what IAPB has told this time. Everyone counts. They say that do not leave anybody. Everyone counts. How do you do? Go to this website where it talks about everyone counts and see. You can register yourself as an independent practitioner, as an organization, and you can pledge. But of course, all of us are busy and going and accessing. Of course, you should definitely go access the toolkits, but through the World Sight Day Initiative, we are also sending you the toolkits downloaded readily for your use. And this Everyone Counts Global Challenge, as of 2 days before, says that when they have just looked at 1 million, they've received 14,697 pledges. What does this mean is that if I say I will do 100 screening, then that goes and gets added. It's only the numbers that they are looking at. It's not that you have to provide them with the data. Okay, and what we are doing, like OATN is doing, is that OCI has initiated this 100,000 screening in 100 days, and we are partnering with all state associations, various institutions, and private eye care practitioners, and putting up this initiative such that they're able to collect the data and feed into the system, the IAPB system, saying that we've screened this much. Okay, now this is the protocol. I mean, when we circulated the video, people said we didn't have time to look at the whole video. So you can take a look at the simple flow chart. If you're looking at screening children less than 18 years, all you need to do is screen them for a visual acuity cutoff of 6/9 or 0.2 logMAR. And if they do not read, then look at refractive error assessment. And if they are reading it, then of course look for external eye examination, color vision assessment, any asthenopia related symptoms, because now that with all the online virtual classes and increased number of gadgets, it's important to screen for asthenopic symptoms, binocular vision anomalies, dry eye disease, and accommodative issues and things like that, right? That's why we put that into it. If you really look at just the screening part, it will take you about 5 minutes to screen per child. And you could do this at the level of community, at the level of your own household communities, gated communities. You could approach even local schools that have reopened that can give you permission, or you could just look at your own patients that are walking in. If they have children at home, then you can look at reaching out to these children. I will tell you how we can reach out to them. But all that is important is that how many do you think you can do? Can you do 10? Can you do 15? What is that you can really do by adopting the simple protocol and looking for amblyopia and common childhood visual impairment related issues? If you're looking at people above 18 years adults, then of course you can look at screening them for visual acuity issues. There's a typo here, it should be less than 6/9. And if you're looking at elderly people, of course, you can use a cutoff of 6/12. And if you're, so there are like screening for refractive errors and screening for cataract. Okay, so basically you're looking at screening for any causes of preventable visual impairment. So basically you do a history, then what you do visual acuity screening, you do external eye examination, and then anybody above 40 with a family history, intraocular pressure, and add your comprehensive eye examination wherever possible. So you can really look at vision screening based assessment. You can look at eye examination based assessment. But whatever you do, everything is a contribution, because Everybody Counts Global Challenge is all about not just doing full comprehensive packages, but looking at screening for even vision screening services that you can offer. Now, coming to this $1 million question of who should I give data to, what data is this, and whether my data, is going to be used and stuff like that. If you see, the bare minimum data that you are expected to provide is on vision and refraction. Of course, if you're looking at other aspects, then you can add that. The Excel sheet has these details. But this is the bare minimum information that we will need to collate and look at what are the preventable causes, what are the causes for visual impairment, and how many of them belong to the refractive category, and how many cataracts and stuff like that. But this data doesn't go to the IAPB. It's only for our understanding as what is the collective sort of information that we are able to get. And we are not going to be using this data for any other reasons without your permission, because it's unethical to be using the data for such reasons, right? Only accumulated information, or information like all the data put together, we are going to say this is the percentage of people with refractive error, percentage of people with cataract, percentage of people at risk for glaucoma, percentage of people that were referred from this practice. That's all. So do not look at, oh, my data is going to be misused and things like that. And of course, it's important to use some standard equipment. This is the list of standard equipments. All you need to do is to have good vision screener. Of course, you can use the ESO's Pocket Vision Screener or a standardized, validated Android app, the Peak Vision app that you can download. And color vision, of course, use standard tools like the screening tool is the Dalton pseudo isochromatic plates. And if you have the Ishihara, well and good, then you can look at pen light accommodative target for NPC screening if you want to quickly screen them. Then good quality pen torch, direct ophthalmoscope, and of course your refraction unit. This is the set of preferred equipment that if you want to look at a vision screening sort of an approach. Then, how do you do it? There are lots of ways. Even by the time I spoke about, you must have got million ideas that you can share. You can encourage your employees and your own families to get their eyes tested. Your own family members, number one. Employees and families, your own family members. Then you can, if you are a social media geek, you can start a social challenge. You can pass on this circle that says that I have gotten my eyes checked. Have you? And things like that. Encourage the elders in the family to get an eye examination done. Encourage parents that are coming to your practice for screening. Tell them about myopia. Tell them about this, 50% of the world's population becoming myopic. Tell them about the risk of myopia progression. Provide them with some guidelines, some pamphlets. Let them bring the kid for an eye examination. Or you can tell them to download the Peak app, do a screening at home for children and elderly people, then contact you for guidance. Then you can take it from there. Then you can, of course, do vision screening camps. And if your patients haven't come back to you in a year's time, send them reminder notes. I know many of you have well-built referral systems and follow-up systems in your practice, but definitely it's time to, sort of like ramp it up a little bit. Then eye examination above 40 years, especially when they have family history of risk factors, then you can definitely use your influence, local NGOs. OAT and team, like 4 or 5 practitioners in the locality can come together and organize something. I mean, all these modalities can definitely improve your own practice, expand the visibility of your practice. Then you can teach self-testing and screen. You can do a video on how to download the YouTube has got good videos on Peak app and how to use and things like that. You can teach your people. There are even paper charts that can be printed for screening, but just be very cautious about the standard letter, the acuity size. And if you have a pocket vision screener, well and good. So there are multiple ways where we can love our eyes and we can be optometry warriors. So basically, just to summarize, there are 3 modalities. Number one, if you say, I'm just going to continue doing whatever I am as a silent participant, do it. Okay. Or you can say, I want to join the campaign. So I'll go to the IAPB's website. I'll pledge saying I want to do 100 screenings. Then I will do it. I will document it. Good. But if you say that I joined the campaign and I'll also provide data because I know the data can be used for future advocacy and we can take a closer look at how things have changed and how much we have contributed. If you want to do that, join this campaign and write to us. We can send you again these extensive videos and the training materials, Excel sheets for the Google Sheets also for entering. But let's do something. Let's just go beyond just doing the regular stuff to doing something so that we step up and show our visibility as optometrists, given the fact that the NCAHP Act is now has become an act and optometrist, the profession is being regulated. And as much as we seek for recognition, it's also important to contribute. And this is the time that we contribute to the Everyone Counts Global Challenge. These are some of the taglines that you can use. Love your eyes, loves yearly eye examination by your optometrist. And love your eyes, loves serving eye and vision care needs of children and elderly. Whatever it is, you could go to the IAPB website and download these posters. Or if you need these posters, we can send it to you. But you can insert your logos as well. And any questions or any support, please feel free to write to us. Let us together contribute to the cause of Everyone Counts Global Challenge. And let us love our eyes and love our patients' eyes and do something for this World Sight Day and contribute to the 100,000 screening in 100 days campaign. That's it. Thank you.